the most important thing about supporting caregivers is why oh you, the collective you, what we can all do as individuals to support our neighbors, to support family members, and we negate the power of you. And I just think that one another, reaching out, supporting one another is really the most powerful thing that we can do. The other thing I think that it's important is that we are all caregivers.
You go and you ask a question, but it's never the right question to get the information that you need. And how do you help caregivers ask the right questions?
Make sure that they have support by paid caregivers. As we heard today, family caregivers need respite, they need help so that they can keep going and keep their energy up. And what is sorely lacking in this state, and unfortunately tremendously lacking now because of the low unemployment rate, is paid caregivers that are paid well enough, that have a steady income. And one of the real challenges for paid caregivers is that they lose their steady income when their client dies or when a family member comes and visits from Pennsylvania, and therefore they don't need the paid caregiver anymore. So I feel strongly that we need to do more to support the paid caregivers. And we're not talking on the nursing level, we're more talking about the direct care workers who do the work day in and day out to keep people in their homes.
I recently read an obituary of a former colleague who passed away due to Alzheimer's, and the obituary read, in lieu of donations to charities, it is requested that you consider, you being whoever's reading the obituary, offering care and respite to those with Alzheimer's disease or other debilitating diseases, as well as to their caregivers. Offering to care for others for a few hours or a few days would be the best gift to honor Jeanette's memory.
Coming up with a policy that will make the community more sociable and friendly so that our elderly folks can have a place to go and the caregivers can feel confident to kind of take them to those places that will kind of brighten up their spirit and their mood.
I would love to see our big old New England farmhouses put to use in a community caregiving scenario.
Being able to use technology and computers to access resources or to go on with Skype and say, help me here and get some social interaction in times of crisis.
And we do a lot to promote the idea that families should have conversations together about what they would want to make for healthcare decisions if they couldn't speak for themselves before a crisis. I think that's the biggest thing we can help families with. It's not about those old people. People of any age might have a health issue come up, and if they can have those conversations and know who the decision maker is going to be, and that person agrees to be the decision maker, and write down what their wishes would be, it's a gift to the family, because then you're not left wondering if you did the right thing. You don't have to guess what your loved one would have wanted. And sometimes it's the closest relative, but not always. It can be a roommate, it can be a neighbor, it's whoever you trust the most to be your person and make the decisions that you would want. And it brings great peace of mind.
A simple thing like just going to the grocery store and not being able to because you got mom at home. Just a simple thing like just walking down the street and walking your dog because you got mom at home and you can't leave her to walk your dog. Simple things are really needed. And you know, today it was very clear that ask for help is a big thing that nobody does. And where do you ask for help? You ask your neighbor. They said you could ask them once, you could ask them twice, but just to have a place where you could go, a source where you can go and ask for the help that you need is really an important thing.